U.S. Senator Kirsten Gillibrand announced that as the Senate negotiates the next coronavirus relief package, she is urging Congress to invest $50 billion in federal funding in order to stabilize child care providers, help them out as the area and the state begins to reopen.
Taking care of the children of our doctors and nurses and first responders and grocery store clerks so that they can take care of the rest of our communities.
Senator Kirsten Gillibrand and Lieutenant Governor Kathy Hochul were in Rochester yesterday to call on Congress to provide a $50 billion child care stabilization fund.
And our need to have essential workers, 65% of whom are women. Did anyone ask the question, who's watching their children?
Officials said at the press conference that the child care industry is on the brink of collapse, as many child care centers will not be able to successfully reopen without financial support and clear CDC guidelines.
Senator Gillibrand says by the end of May, 47 out of 102 child care providers in Onondaga and Cayuga County had to close.
The leaders are asking for child care help. Senator Kirsten Gillibrand and Lieutenant Governor Kathy Hochul say if children are home, parents can't go back to the office. Gillibrand says the Senate should include $50 billion in aid for daycares. Hochul agrees and says there should be clear guidelines on how to keep children safe.
Today, Lieutenant Governor Kathy Hochul and Senator Kirsten Gillibrand shined a light on the issue during a visit to the Capital Region.
Joining Troy Mayor Patrick Madden and Assemblyman John McDonald at the Troy Unity House to send a message to Washington.
Without adequate federal assistance, they're at risk of losing 4.5 million child care slots nationwide.
Parents across the Hudson Valley head back to work. There's a new push to try and make sure child care isn't an issue. Senator Kirsten Gillibrand teaming up with Lieutenant Governor Kathy Hochul in the fight for $50 billion in funding for child care providers in the next stimulus package.
Here in New York, that would mean the availability of child care could drop from 1 slot for every 4 children to 1 slot for every 8 children.
Stopping by Ithaca's downtown child care center to drive her points home. This bill, proposed to the CDC, would go toward every aspect of the child care services, including funding losses due to COVID and hourly pay.
And so what this $50 billion package would do would build the resources we need to have child care at the full level that we would need over the next 5 months.